Good morning, everyone. Thank you for joining us this lovely morning for a COVID-19 community webinar. I'm Joey. I'm from HealthMetrics. I'll be hosting today's webinar. And it's our privilege and honor to have Dr. Ernest Poh today to speak about COVID-19 vaccination. A brief introduction on Dr. Ernest Poh. He's a consultant respiratory physician in UMMC and UMSC. He's currently an associate professor in Faculty of Medicine in University of Malaya. During this time, he's also co-managed COVID positive patients in UMNC. He treats various diseases regarding to the respiratory and sleep condition, and he has an interest in lung cancer and also COPD. Without much further ado, we're just going to start the webinar. There are a lot of questions we have received the past over a week ago, up till yesterday. So we want to utilize this time to ask as many questions as possible to Dr. Ernest Poh. Good morning, Dr. Ernest Poh. Thank you for joining us today for this community webinar. I'm just going to start off with, so you, in your biography, you mentioned about handling COVID-19 patient. What was your experience like?
Oh, okay. So we started off in with the first MCO last year when it first came to Malaysia, and things were pretty scary back then. We didn't know what the transmission of the virus was. It transmitted via droplets, via airborne, and we had to take a very strict conditions to manage patients who were infected with the virus. As the numbers slowly climbed and more research came into the modes of transmission, we became more efficient in knowing how to isolate patients, knowing how to protect ourselves as well, because during then there were a lot of hospital transmissions as well, because we sometimes patients would come in would be negative upfront, but then they become positive much later. So there was a few outbreaks in a few wards. But since then, we have managed to create a system that is more efficient to identify patients who we suspect to have COVID-19, even though their symptoms may be a little bit unusual. And of course, most of the healthcare workers would have been vaccinated by now. So the level of fear or apprehension towards managing these patients have become much more tolerable or much reduced in recent months.
Oh, that's good to hear. So you mentioned about the frontliners, the medical personnel being vaccinated, and now everyone is talking about the vaccine itself. You want to share a bit of your own experience of how was it like for you when you get your vaccination?
All right. So most health care workers, as you know, in this country would have received the Pfizer vaccine, and this sorry, choked on my own saliva. Anyway, the Pfizer vaccine has a very, very good efficacy, and although it's quite a new technology using the mRNA technology to produce the vaccine, throughout their clinical trials that has been published in many international journals, the reported side effects are very I mean, the common ones you will meet, but then the rare side effects are very, very unusual. And it was the right thing to do at that point of time, because if you calculate the risk of this being exposed to any patients potentially having COVID and getting COVID itself, it makes a lot of sense to get the vaccine, regardless of the very, very rare side effects that you may potentially encounter with the vaccine.
Right. There's a questions from the audience. Yes, we will be accepting questions during this session, so feel free to put your questions on the live Q&A, and we will answer them accordingly. So thank you so much, Doctor, for sharing with us your experience on how was it like getting the vaccine, and how was your experience handling it in the first place. We're really glad that the frontliners like yourself are vaccinated, and thank you so much for all you have done throughout this past 1 year. I'm sure it's not easy, and with current MCO, it's probably more difficult on your end. We're just going to pick some questions from the audience. I do know there's so much of recently we just have the voluntary registration for AstraZeneca vaccine, And people have putting questions about the differences. Just now you mentioned about Pfizer having a lot of research being done, and the risks are really, really low as compared to the advantages of having a vaccine. So could you tell us the difference between like a Pfizer and a Sinovac and an AstraZeneca vaccines?
Okay, so broadly speaking, there are, three types of COVID vaccines that are in the market at the moment. So I've already mentioned one of them, which is the mRNA vaccine, which Pfizer and Moderna uses. So just briefly speaking, the mRNA vaccine contains an mRNA, which is like a messenger piece to synthesize a messenger gene to synthesize a part of the spike protein that is present on the coronavirus. So when you inject the mRNA, of course, it's enclosed in a nanolipid particle, and to protect the mRNA gene, the cell that it gets injected to will absorb the mRNA, and then it will start to produce the protein so that the spike protein appears on the outer part of the cell. So it mimics, it's sort of like a coronavirus in disguise. It uses a normal cell, make it to look like a coronavirus, so that the immune system would be able to identify that as foreign and develop antibodies towards it. So that's the mRNA vaccine. We have the AstraZeneca as well as the Johnson & Johnson vaccine, which will be coming in, as well as our Sputnik V vaccine from Russia, which uses the technology of viral vectors. Now, viral vectors uses either a human different type of virus called adenovirus, and for the AstraZeneca vaccine, they get the adenovirus from the chimpanzee. Whereas from the other vaccines like the Sputnik V as well as the Johnson & Johnson vaccines, they would use adenovirus from humans that are known to infect humans, and so these are human adenovirus. What they would do is these virus would become vectors or carriers. They will carry the DNA, a part of the DNA of the COVID-19 virus into the body. So they behave like a carrier, just like a train transporting a DNA into our system. So these viruses have been genetically modified so that they do not replicate in our human cell. That means they do not replicate and infect us and cause symptoms. They behave solely as a carrier. So what is important is the DNA that is within this virus. The DNA again encodes the spike protein, a part of the protein of the coronavirus itself. When it gets injected in the body, our cells absorb this virus, absorb the virus into the body. The part of the DNA actually goes into the nucleus of the cell, and from there it gets translated into the mRNA, which we mentioned just now as the Pfizer and the Moderna vaccines. The mRNA comes out of the nucleus, goes into the other parts of the cell, and that's where the protein is produced. And then similarly, the protein gets expressed on the cell. The cell becomes like a virus in disguise, and then the body activates an immune system towards the spike protein of that infected cell. So because the DNA is used in this sort of method, this sort of vaccine is more stable, because mRNA gets, if there's any change in temperature, it needs to be stored in -70 degrees in the Pfizer vaccine. And if there is any change in it, the mRNA will disintegrate or will become, there will be damages done to it, and it will not be able to do what it's supposed to do. Whereas the DNA vaccine is more rugged, so it can tolerate higher temperatures, and that's why the AstraZeneca vaccine does not need to be stored in below freezing temperatures.
Okay, that's very informative, Doctor. Yes, please continue. It's just good to know that. Yeah. Sorry, please continue.
No problem. So the last type of vaccine is the inactivated vaccines, which China are known for. And the inactivated vaccines are the oldest form of technology used to produce vaccines, where we actually take the virus itself, inactivate it or kill it, and then through processing, we inject it into the human body, and our human would recognize the virus as foreign and develop antibody towards the virus itself. So it's the oldest method of producing vaccines. Most of our other vaccines are produced this way. So those are the three sort of methods that or technology that are being used for the vaccines these days.
Then I'm going to ask you a question. Thank you so much for explaining the differences between Pfizer, Sinovac, and AstraZeneca. Would you, in your opinion, is one more superior, or do you think most of them are just equal? It's just different technology, but they have the same efficiency?
So with each vaccine, obviously the efficacy or how effective the vaccine is able to protect a person from a symptomatic transmission or an asymptomatic transmission differs. So you have different rates of efficacy for different types of vaccines. But the important thing is to note that this is not a competition between trying to get the best, most efficacious vaccine out there. The concept is that we are trying to vaccinate as many as people as possible to protect those people that we cannot vaccinate at the moment. So this is what we are hearing very common nowadays, called herd immunity. So that is what we are trying to do. We're trying to vaccinate as many as possible using whatever vaccines that we have, in order to try to achieve that 70 to 80% protection of the community, so that the other 20% of the community that cannot be vaccinated will be protected.
So, Doctor, it's good that you mentioned about herd immunity, and we need to achieve 80% in Malaysia in order to protect the 20%. Could you explain more who should not take the vaccine or who can't take the vaccines?
Okay, so at the moment, I think this question is a bit of a double-edged sword at the moment, because at the moment we don't have enough supply of the vaccine. So actually it's that a lot of people want the vaccine, but they can't get hold of the vaccine at the moment. So but if, let's say, vaccines are available, like there is, oops, I'm breaking up. Can you hear me?
Yes,
Yes.
I can still
Okay, so
hear
let's
you.
say if there is endless supplies of vaccine, and supply is not an issue, then people who would be a bit more cautious include children at the moment. There is no data for vaccinating children below the age of 12 at the moment. Pfizer has just came out, recently, that they have data for vaccinating children above 12 years of age now. And so in the US, I think FDA may be approving an indication to vaccinate teenagers above the age of 12. And they are also looking at clinical trials to determine the safety in children below 12, from 5 years old to 12 years old at the moment. But because this group of population, in children, when they actually do get infected with COVID-19, the death rates are very, very low, and they don't run into that much complication. So of course, there's this issue about, with the global shortage of vaccines, whether it's actually right to vaccinate children when actually there are a lot of people dying from COVID without protection because of a shortage of supply of vaccine. So this is one issue that I think the United States has to address. There are also new data on pregnant women. So again, I think Pfizer seems to be leading the game against testing in special population groups, although AstraZeneca has also started to do these trials. And of course, phase 2 clinical trials so far has shown that there are no safety alerts to be concerned when the pregnant women were vaccinated with COVID-19. So I guess all these are just off indication labels at the moment, and we will not recommend these to anyone who is pregnant or breastfeeding or lactating, and children at the moment, unless your risk is really, really very, very high. For example, if you are a health worker who is pregnant and you are working in India at the moment, and everywhere is just COVID. And I think for women, if they who are pregnant, and if they do get COVID-19, the complications are very, very high. They can run into all sorts of problems, including premature delivery, They can get into blood clots and all sorts of issues. So if you are, let's say, a healthcare worker and you happen to be pregnant in India, obviously, you know, you will be using the vaccine under emergency conditions. And even though there is no safety data available, you would know that the chances of you getting COVID and the complications that would arise would be much, much higher than whatever vaccines that you are taking.
Right, doctor. So you mentioned, would your advice be for pregnant and breastfeeding? So you mentioned Pfizer have done some studies on it, and Astra is looking into doing that study. So what would
They have already started. They have already started. Yeah.
So what would be a simple advice? Will it be if you're pregnant or planning to get pregnant, or you're breastfeeding, would you advise them to go get a vaccine?
So far in Malaysia, and of course these are not indicated, they are not approved by the National Regulatory Agency at the moment. Even in the FDA has not approved this group of population to be used on this vaccine. So all this should not be promoted and not to be encouraged at the moment, because we do not have enough data. So people who are planning to get pregnant, or who are pregnant, or who are lactating or breastfeeding, then this group of patients should avoid the vaccines at the moment until further data is available.
That's very helpful information, doctor, because I guess this is the group of people we want to protect as well. So essentially what you're saying, like if you're healthy and you have no any severe allergies, you should get vaccinated to protect those who can't take the vaccine, for example, getting pregnant or lactating women, right?
So even for allergies, I think let's briefly talk about allergies. I think allergies, unless there is obviously you would get assessed during your vaccination, but allergies itself is not a contraindication to vaccination. You can still get your vaccine, and there would be a 30-minute observation period after the vaccine, because usually allergic reactions or even more severe anaphylactic just means very, very severe allergic reactions happen within the first few minutes after getting a vaccine. So this group of patients would be monitored very, very carefully, as well as there will be medical people on standby to give the first-line medications to counter any severe allergic reactions. Again, the allergic reactions that have been reported across phase 3 clinical trials have been very, very low.
Okay. I hope that answers some of the questions. And this was a question submitted from the form from the audience. If I was infected with COVID-19 previously, does that mean I don't need to take the COVID-19 vaccine because I have the antibody?
Okay, so yes, a very, very good question. So as you know, as our numbers are climbing at the moment as we speak, most hospitals and ICUs would be full with COVID patients. You may have some friends who have actually had COVID as well. I mean, this round, I think it seems to come a little bit nearer to me. And some of my friends who had contracted COVID, whereas the last round, a lot of them were like, second degree, third degree. Or I met somebody who had a contact with COVID. But this round, there were a lot more close people that came down with COVID. So the question is, natural immunity will definitely occur, but nobody knows how long the natural immunity will last. So it may be 3 months, it may be 6 months. Nobody knows how long the natural immunity will last. So that's why it is still recommended that even if you have had a COVID infection, the CDC recommends that you do not get vaccinated in the immediate event. So you should wait for all the acute event to settle. But of course, different guidelines have different recommendations, and it's generally quite safe to take the vaccine after 14 days, or some people would recommend even a 90 days wait after after you contracted COVID. But it is important also, as I said just now, it's not so much, these guidelines can be just guidelines, they are recommendations, but you also need to assess how risky you are of getting COVID again, because there are cases of reinfection. So of course, if the community transmission of COVID is very, very high at that point of time, and you just recovered from COVID, there's no data to suggest that you may not get COVID again within the next 1 month. You may still be infected. So if this is the case, then we would also recommend vaccination at this point of time.
Okay. Then the next question you talk about, immunity, right? So in the previous question, you talk about herd immunity. So a lot of people talk about herd immunity these days. And so why do we not talk about this before that? Like for example, flu virus, right? Flu virus mutates every year. We did had an influenza H1N1 outbreak last year, January. Could you just explain more? What if someone wants to take a flu vaccine, but at the same time they had a COVID-19 vaccine? What are the gaps for different vaccines? So do I have to wait a few weeks or a few months before I take COVID-19 vaccine if I have a flu
Yes.
vaccine? Yeah.
So a very good question as well. And we do get that quite often. So the flu vaccine, as you know, or the influenza vaccine is given on a yearly basis. Once a year, you would get a vaccine that is dependent on the strain that is more prevalent either in the southern or the northern hemisphere, and the vaccine lasts for a year. So if you happen to have a influenza vaccine, and you registered for your COVID vaccine and that happens, you need to give a time frame of about 2 weeks. That is what CDC recommends. Although in general, there's still, and the 2 weeks is just because there is not much data available on whether there could be any potential interactions between the two vaccines. But of course, again, guidelines differ across the world. In the UK, for example, they see no reason why you should delay the vaccine. If you can get both of it at the same time, they do not make a specific recommendation against that. But in the US, the CDC do recommend that you at least wait for 14 days after you have gotten any other types of vaccines.
Great. So now we talk about the gap, and it's really a case-to-case basis. I think there's a lot of questions on a lot of us, even myself. Like, if I get a COVID-19 vaccine, how long will it last in my body?
Okay, Joey, just before we touched on that, I think just to
Yes.
elaborate more on, I think your previous question on why we do not talk about herd immunity with other sorts of viruses, for example, the influenza. Why do we not try to achieve herd immunity with just by vaccinating everybody with the influenza virus? And that's because certain types of virus mutate at a very, very fast rates compared to, of course, you have seen the coronavirus itself we have had some funny strains coming in recently. But those other viruses, they mutate too fast for you to develop a vaccine fast enough to be able to cover the different types that are out there. So you have the pneumococcal vaccine, you have the influenza vaccine, and all this is difficult to achieve herd immunity with those because the virus just mutates too quickly and changes too fast. And so what is important is to protect people who are vulnerable. So we promote the influenza vaccine or the pneumococcal vaccine towards people who are at risk.
Okay.
Okay,
Thank you
now
so
back
much,
to
Doctor.
your question.
Now back to the question.
What was it about again?
It was because we talk about immunity so much that, I think there's a lot in our head that, like, how long does this COVID-19 vaccine immunity last? No one knows. So, like, I wanted to
Yes.
hear from your opinion. Yeah.
Yes, and you're right that there are not enough data at the moment because the vaccines only started rolling out globally, I think middle of last year, which was around June or July. And at this moment, we are only about about the 10th month or the 11th month mark of the vaccines itself. And I think a lot of studies are still being done to see how immunogenic the vaccines are, which means how long the vaccines can trigger immune response. But it is generally said to be quite long because our body does have a memory cell that actually remembers how the spike protein looks like and develops antibodies towards it. So the memory B cells or the immune cells that we have actually do play a very big part in us maintaining immunity towards the virus itself. So it's generally postulated anywhere above 6 months or even 9 or even up to a year. So I mean, we need to wait for more data to come on the different types of vaccines. And of course, different vaccines may potentially trigger different form of different types of immunogenicity. And of course, the duration whether a booster shot is needed. All this will come to play as time goes on.
Right. And now we talk just on the questions about immunity, and we are not sure until we observe much later, right? It feels like, the whole world is an experiment in itself. So another one of the question came from the floor was that once we're vaccinated, let's say, like you mentioned just now, this time around the wave of COVID-19, they're just people we know they are infected, like like you mentioned, your friends, and I personally have friends who are infected as well. And what happens if we come close contact with a positive patient, even though when we're already vaccinated? Is it possible to be reinfected? Yeah.
Well, so again, even if you have been vaccinated, as I said, the vaccine is not 100% efficacy. You still have a small percentage that you may potentially be infected with COVID. But however, the vaccine protects you from the serious side effects of the virus itself, because your body would have already developed antibodies developed to kill the virus before it infects your lungs or more or cause havoc in different parts of the body. So definitely you would be able to protect yourself against the serious side effects. Now, how much at risk of you getting the virus itself? Again, it comes down to the SOP that we have been hearing over and over and over again. Did both of you wear a mask at that time when you meet? And how long did you meet? Was it in close contact? Were you eating together? I think eating is a very high transmission factor, because when you eat, you talk and you take down your mask. And so if someone is positive in front of you, the risk of transmission is very, very high. And that's why I think the government has to close the dine-in at the moment when the cases are so high, because the transmission during eating is very, very high. So just to quote an example, I had a friend who was just having a meal with someone who didn't know he was positive, and then after that he contracted COVID himself. So this is how dangerous the virus is. It has a very high transmission rate if you're not doing certain things like wearing a mask to protect. The wearing of the mask actually protects other people from you. If let's say you didn't know that you have a virus, and you are trying to prevent the transmission of the virus to that person. So, so all this SOP, strict hand hygiene, everything still has to maintain, even though you have been vaccinated. It just reduces your risk of getting infected, but also getting the serious side effects of the vaccines, of the virus, sorry, of the vaccines.
It's okay. I think just because you use that word so much, and I'm sure you use it every single day.
And they both start with B.
Yes. So like you mentioned, I really wish your friend just get well soon. And there are a lot of questions for IC that's published on AstraZeneca. So I think it's just all the buzz this week because we just started the voluntary vaccination for AstraZeneca this week.
Yes.
So one of the questions from the audience was, is it safe for senior citizens?
Okay. Right. So generally, all these vaccines are used in emergency conditions, and we don't really have long-term data on the side effects of the vaccines. Just pertaining now to the AstraZeneca vaccine. So a lot of hype has been on this vaccine because of the incidence of some blood clots within a certain population of people. So in the UK, they have vaccinated almost more than 20 million people now with AstraZeneca vaccines. And out of this, there was a reported incidence of 79 cases, more in the women as well as in the younger age group, of which about 19 of them actually passed away due to the complication of the clot. Now, whether the vaccine, I mean, the authorities have not said that there is a direct causal relationship. That means you can't just say in a statement that, oh, AstraZeneca vaccine causes blood clots. That's a very, very not evidence-based thing to say.
Fake news.
But there is some correlations between the two of them, because these blood clots events has also been seen in the Johnson & Johnson vaccine itself, which uses the viral vector technology. So a lot of scientists are looking at all this reported adverse events and trying to see what could possibly be the underlying factor that triggers off this rare clotting event. Now, the majority of age group that has been, of the adverse events were usually in the younger population group. In the younger patients, on 20 to 29 onwards, and then 30 to 39, you can see that the risk of getting a clot is, although still very, very rare, it is generally a bit higher than the older population age group. So it hovers somewhere around 8 to 11 per million people that you vaccinate if you are young within the 20 to maybe 40 age group. And as you grow older, the incidence of blood clots in this group of patients actually drops to very, very low, to about maybe 4 in a million. That's what has been reported in your media, that you see 4 in a million. That is the age group that is usually above 50 years old. And so for a lot of countries, they actually do, for example, in Australia, they actually reserve the AstraZeneca vaccines for people above the age of 50. So that is why towards that question, whether it's safe for people who are older, actually the safest group to get this type of vaccine is actually those above the age of 50. But we do see in this voluntary sign up that a lot of young people who are in phase 3 have signed up as either a reflex response or just maybe, as you have pointed out, whether they are tech savvy and they've just rushed to get the AstraZeneca vaccine.
Yeah. So you hear it from Dr. Poh, sign up your parents, sign up your grandmother and grandfather for the next batch of vaccine. Yeah, another question that from the audience was, so with having vaccines, whether it's Pfizer or AZ or Sinovac, is it still effective in preventing hospitalization and death in the face of the current variants in the country? I think that's a very good question.
Yeah. So I've generally said that they do protect you against the serious side effects of the virus itself. So across all the clinical trials, people who have been vaccinated, there was a significant drop in hospitalizations due because of, as a result of side effects of if you do contract COVID and you need to be hospitalized, all these incidences were much lower in the arm that was vaccinated with vaccines. So they do protect you against the side effects of COVID, the serious side effects of COVID itself.
Okay. So just now you mentioned about, how vaccines protect, and you talk about immunity, and how some virus, for example, like influenza, mutates too fast for vaccines to develop. So there is some buzz going on right now where they ask about, if I take a COVID-19 vaccine, will it be against certain variants? Like now we have the India variants, we have the South Africa variants, we have the UK variants. Will it still be effective to these variants?
Yeah, so I think just to correct a little bit on what you pointed out about the influenza. So it mutates so fast. There are vaccines available. It's just that we can't achieve herd immunity, because you may be protected against a certain strain, but you will not be protected against a certain strain. So the same question applies to COVID as well. So far, all the mutations, they don't mutate as fast as some other viruses like influenza, but so far the strains that have been coming in, and research has been done on this, the vaccines do protect so far against the strains that have been reported, although because these strains are only in certain parts of the world at the moment, and they are slowly creeping into other countries. To do a clinical trial, to design a clinical trial just for that strain itself, or just for that, it's going to take time, and it's going to be quite difficult. So they have done it to
I guess.
Correct. They have to replicate the whole entire clinical trial again to see whether it protects against a particular strain. So for the time being, experts believe that these vaccines do protect against the strains, but nobody knows, in the future, if the virus manages to mutate again and comes out with a super virulent strain, that the vaccine will not be able to protect against. So this is still something of research and questions.
Oh, wow. So many questions in the air. A lot of questions are very concerned about their parents. So one of the couple of questions we received from the audience was that some of their parents or close one have heart-related issues, or they had a bypass, and they are concerned about the vaccine towards their heart health. Any general advice on that? Yeah.
So far, we do have a lot of data from the US vaccines on patients with comorbidities. Comorbidities meaning that they have an underlying medical problem. It could be diabetes, it could be high blood pressure, it could be a cardiovascular problem, it could be a lung problem, or it could be a kidney problem. A lot of these patients are recommended to get the vaccine, because obviously if they do encounter COVID itself, they will get a lot of, they will get into big trouble. So it is generally very, very safe for them to get the vaccines. However, if we are talking about certain vaccines like those from the China vaccines, we need to look into detail, because a lot of some of the China vaccines do not have a lot of data on patients with comorbidities. So it's a very small of patients. They look, a lot of them look at patients who are obese, and obesity is a comorbidity. But when you dive down a little bit deeper into the different patients with comorbidities, I think a lot of scrutiny we have to look at those sort of data. And some of these data have not been published in peer-reviewed international journals. So we do have some, but we do not have enough. So again, it is too early to say whether there are potentially any side effects that may occur. But generally, this group of patients, if you weigh the risk versus the risk of getting COVID and the complications that can potentially occur versus the side effects that can potentially occur as well, then obviously you will know which arm to follow. So generally, this is not a medical advice and not a blanket rule for every single patient out there, and this is not intended to be a medical consult as well. So it is always good to check back with the doctor that is treating you whether a certain type of vaccine is not recommended for you. And also on that day when you are actually at the National Vaccination Center, a lot of these details would be screened through, and you would be attended to by a doctor as well, a medical personnel as well. And if there is any doubts of a certain type of vaccine not being suitable for you, they would usually not recommend you for that vaccine on that day. So these are also things to be aware about. However, generally across all the vaccines so far, these group of patients remain at high risk if they do develop COVID, and the general recommendation is to go for the vaccination. So there is no issues with patients who are on blood thinners. For example, if they have a heart problem, and they are on aspirin or on warfarin or even the direct oral anticoagulant. For example, the European Society of Cardiology recommends COVID-19 vaccination for all these patients. The standard procedure would be to use a very small needle, about 23 gauge needle, and to apply firm compression at the area for 2 minutes after the injection to prevent any bleeding at that area. The patients may potentially get a bruise or even a swelling at the area because they're on blood thinners, but usually the complications are not severe. Yeah.
Okay. Oh, thank you for answering that question. And we did receive some questions about, like what Dr. Poh said, do consult your consultant or the specialist that's attending to your heart issues or any of your comorbidity issues, so that they can assess whether you're suitable for the vaccine itself. Another question from Amanda from the audience was, what's your view on Thalassemia Beta carrier? Is it not recommended to take the vaccine or just avoid AstraZeneca vaccine with a smiley face?
Thalassemia Beta carrier. So thalassemia is a condition where you carry a gene that can potentially cause your red blood cells to be destroyed by the body at a faster rate than a usual person. So these patients can sometimes be anemic or have a very mild anemia, which means low hemoglobin levels. Generally, they do not have any problems with clotting or bleeding and stuff like that. So there is currently no evidence to say, and it's not a contradiction to not take the vaccine at all. You can still take the vaccines even though you are thalassemic. Okay.
And then we'll go on to the next question from the audience. Will mRNA change our gene? Is there any facts or studies to prove that?
Well, no. At the moment, if you're talking about the the Pfizer vaccines or the Moderna and also the inactivated vaccines, they do not enter into the cell nucleus at all. The viral vector cells, the viral vector vaccines that do carry the DNA into the cell, actually the virus are unable to replicate itself, and the DNA is only used to produce the mRNA once for the COVID spike protein to develop. So actually it does not alter your DNA and your genes at all.
Oh, I hope now everyone has more factual. I think there was just a lot of news online, right? And I hope that answered your questions, whoever that posted it. There's another question from the audience. If a vaccinated person is infected, can the vaccinated person infect others?
Yes, potentially. So there are still a lot of studies being done on transmission. So the vaccines protect you against the serious side effects, as we mentioned earlier, but there is still not enough data to know whether they protect against transmission. So you could still be carrying the virus, you do not feel anything, or you don't feel any serious side effects, but you can still potentially pass the virus on to someone.
Okay.
So the transmission is still something of a big question. Of course, researchers and experts believe that there are some reductions of transmission because generally you will be more asymptomatic, means you will not have any symptoms after contracting COVID. And of course, asymptomatic patients generally don't transmit the virus so much compared to someone with symptoms. So if you're having symptoms like a viral, like a runny nose, a cough, or whatever it is, you tend to transmit the virus much more than someone who has no symptoms at all.
And that's why it's so important to follow the SOP, like just wearing your
Correct.
mask itself.
Because
Yeah.
you're actually protecting your loved ones. Because even though you have got the vaccine, you don't know whether you are still potentially able to transmit the virus on.
Yeah. Does that mean I have to wear a mask when I'm at home too?
Unless we achieve herd immunity, something like what Israel is doing. You know, they have vaccinated almost 80% of their population right now, and they are going out without masks.
Oh, okay. We hope that will be possible one day with Malaysia. So guys, wear your mask. It's very important. So I think just to summarize what Dr. Poh was saying, essentially having COVID-19 vaccine is important just so that you can reduce your symptoms. You can reduce the severity of being hospitalized. It helps with our healthcare system. It does not mean that you will not get it again. I think people generally had this perception, oh, if I'm vaccinated, I'm free to go party, but really that's not the case. Am I right, Dr. Poh?
Yeah, unless we achieve herd immunity.
Yes, we're there, I guess. We're working hard on it. Yes.
Yeah, the issue is the supply, of course. I mean, it's slowly trickling in. I mean, vaccines are slowly trickling in, but yeah, the supply is a little bit slow at the moment. Yeah.
Yeah, and that's not in our hands. And the best we can do right now is really to follow the SOP. There was a question from the audience. Earlier, you talk about the difference between mRNA and adenovirus and inactivated virus. And the question from the audience was, is inactivated virus vaccine the safest?
Okay. So the golden question. A lot of people believe that because the technology is the oldest, so there's so much data available on this sort of vaccines. But with each type of vaccine, actually the every vaccine is unique by itself, and that when the researchers create a vaccine, they would still need to test it out in phase 1, 2, 3 clinical trials before we can say that it is the safest or anything. But so far, you can't really say that the inactivated vaccine for COVID-19 is the safest so far because, as I pointed out earlier, there are some lacking data in terms of comorbidities, and China vaccines have been a little bit slow towards publishing in peer-reviewed international journals. There are some data, but they are not as comprehensive as the US and the European data. So to generalize and say that one vaccine is more safe than the other at the moment is still, I mean, there is no truth in that, because what we can see is, you know, sometimes you may not know certain things about certain vaccine just because it's not published, it's not reported. So there is still a lot of, I mean, of course, there are concerns, but one thing to note is that these very, very serious side effects are very, very rare. And I think one thing that I needed to bring up is that you need to have a calculated risk. How at risk of you of getting a COVID-19, and if you do contract COVID-19, what is going to be the outcome? If you have a lot of issues with your health, or you are in an age group where you are very vulnerable and that getting COVID-19 means the end of you, then there should be no hesitancy towards getting a vaccine. And there is no one vaccine that is safer than the other at the moment, because these rare side effects are very, very rare, and you need to calculate the risk and the age group that you're in to weigh the benefit versus the risk of getting the vaccine itself.
Thank you, doctor. I think like just to summarize, yeah, it's really important to calculate your risk, and that's the reason why we have this webinar, so that it's really essentially to educate the community, like what are the factuals, information there, because there's just so many things that we can Google these days, right? And one of the questions from the audience was, the person is a recovered patient from COVID-19. Is it advisable for them to take the vaccine? I believe doctor have answered this earlier. It is advisable for you to take your vaccine after 14 days.
At least after 14 days. But some guidelines recommend even up to 90 days after that. So it really depends. If you're at a high risk group of getting COVID itself, and then why not get it after? I mean, if you have access to it, then why not get it after the acute infection has settled?
Thank you, doctor. And another question from Karen was that she came in contact with someone who was positive. How soon should she get tested? Because I think a lot of people do not know what are the incubation, and it's still in the air, right? Like, oh, do I get tested the moment I know my friend is positive, or do I have to wait a few days for it?
Yeah, so I initially wanted to do a video on this last year, but then I was just too busy with work. So anyway, when you do come into contact with someone who is, so it really depends. So but the ministry has come out with clear guidelines as well, whether the person that you come into contact with is a positive himself when you met him or her, or it is just, another friend, he or she met another friend who was positive and he's getting tested. So it depends on how far the link is. But let's just take, for example, you met someone who didn't know he was positive and then later on became positive. Okay, so that means he is having the COVID virus, but he didn't know. Okay, and then later, about 2 days later, maybe he had some symptoms, and then he went to check, and then he found out that he's tested positive, and then he told you that, oh, I'm positive, and I had a meal with you 2 days ago. So by right, we recommend getting tested if that person is positive, and there was a period of time where you met him without, both of you were not wearing a mask. Again, you have to calculate the risk. It is recommended to get tested immediately because the virus takes about it can take anywhere from 1 to 5 days to incubate, and then it could manifest itself. So you can get one done, but that does not mean you can go around running around because you already had a positive contact. It means that you should stay at home as much as possible, quarantine yourself for a little bit, and then get it tested again after 5 days. That's the general recommendation at the moment, if you do not have any symptoms. After 5 days, if your result is negative, it's very highly unlikely that you actually contracted the virus.
That's very good answer. I think, Karen, as what Dr. Poh said, if you have no symptoms after day 5 and you got tested, it's negative, then it's pretty confident it's negative. This is a very good question from the audience. Can they still donate blood after being vaccinated? And as we know, we are a lack of blood in our blood bank. Yeah.
Yes. There is no, I mean, this is such a niche group and such a niche need at the moment that there is no data or no contradiction to get donating blood after getting the vaccine.
Okay. So yeah, whoever answered that question, you feel free to donate your blood after being vaccinated. Another question is, do you recommend our parents to bring along their medication to the doctor for assessment during the vaccination appointment?
They can bring a list if they want to. They can bring a list, but generally, I think if you are not on any, like, for example, blood thinners, or if you are not a cancer patient that are on some immunosuppressants or rheumatological disorders, then I think these medicines have to be made aware to them. But if, let's say, you are on just a general medicine, like for example, for hypertension, high blood pressure or diabetes, then you don't need to bring all these medications to the doctors unless you have a specific condition. For example, you're on a blood thinner, or you are a cancer patient on certain forms of chemo or immunotherapy, or any drugs or targeted therapies, or if you are if you have some rheumatological or some other conditions that causes you to need to take immunosuppressants, then I guess these are a medication list should be given to the doctor so that they are aware that you are this sort of patients. Again, they will probably monitor you a little bit longer after the jab, maybe 30 minutes, but generally it is not a contraindication to getting vaccinated.
Okay. Um, Thank you for answering the question, doctor. So yeah, you can bring a list of, whatever your parents are taking, just to the attending doctor during the vaccination day. Unless you're on blood thinners or a cancer patient, then you might need to be monitored longer. Am I right, doctor?
You will need, if you have certain health conditions that you are taking drugs that are not like common, like not in the general population, like hypertension or diabetes. So that means more drugs that are potentially can affect your immune system or blood thinners, then you should just bring a list along so that they are made aware that you have this. And of course, for example, if you're on blood thinners, then they would need to compress a little longer on that side for at least 2 minutes after they have given you the injections.
Okay. Thank you, Dr. Poh. And I think now a lot of people have signed up for the vaccination voluntary. And one of the questions from the audience was, is there any preparation required before taking the vaccine, such as food to avoid? Do you have any general advice for people before they go see the, before they go for their vaccine?
There are no dietary restrictions or anything to be watchful for. I think some patients would generally just feel a little bit more anxious on the day of the vaccine because they're getting something foreign jabbed into them. And of course, I guess what I just tell my patients usually is just go with a light meal. Don't take too much food. Otherwise, you may because of all the anxiety and all the hype, you may feel very anxious. You may feel like you want to throw up. And this is something that you don't want happen on the day of the vaccination itself. So do eat, of course. You don't want to faint as well if you are like low on sugar, but take a light meal before you go for your vaccine.
Yeah, thank you, doctor. And this is a question from Logesh. We know so little about the efficacy of Sinovac with varying efficacy in various countries. Do you have any updates of this or any side effects of Sinovac?
No, so my updates is exactly the same as whoever asked that question earlier. It is all from the reported, all the press releases or the from the company itself, all the reported clinical efficacy from their phase 3 trials. There are a huge, of course, a variation between the efficacy of the Sinovac vaccine itself. But as I said correctly earlier, anything that has been approved by the FDA but the Sinovac is not the FDA, obviously, it's the China, but by the national regulatory authorities, then as long as they do offer a certain amount of protection, then that would contribute towards achieving herd immunity in the country. As I said, that efficacy shouldn't be the number one concern on. Obviously, if it is more than 50%, and most of the time they would already been approved because you're already reducing the risk of contracting a severe COVID infection by half. So this is not a competition of getting a better vaccine over the other. It's just trying to see how much people we can vaccinate to protect those that we can't.
Right. Yep. And the next question was, there's reports stating that Pfizer vaccine has caused neurodegenerative disease. Is there any truth to that?
So they are still investigating. As I said, whenever all these adverse events gets reported, all the authorities will have to look into it to see whether there is a causal relationship or just a correlation. But so far, none of this has been given a red signal by the US FDA authorities.
Okay.
So there are some case reports here and there, whether it's actually, even during the clinical trials, whenever a volunteer that goes for a clinical trial and there's a death encountered and the cause of death may be reported as such and such, the investigators will have to look and see whether that cause of death is related or caused by the vaccine itself. And so all these reported case reports would have to be scrutinized into deeper levels. Once there are more cases, for example, the AstraZeneca blood clots events in the UK where they have vaccinated more than 20 million people gets reported, then you see that there is a pool of patients that they can work with to find whether there is a causal relationship or not. And still to now, there is a correlation, but not a direct causal relationship with the vaccine. And again, there are certain population or some age groups that are more at risk than the other of getting the rare side effects.
Very good answer, doctor. Thank you. We do only have 4 more minutes left, so I'm just gonna quickly go through like the last 3 questions. Someone on PL wanted to ask Doctor, is there any clinical study done on samples on the second dose of AstraZeneca for 12 weeks later?
Yes, so clinical trials have been performed. So the initial trial used, I think, 28 days as the cutoff. But then there have been trials, there are ongoing trials to look at delaying the second dose. And even this has been reported to achieve a better efficacy in a peer-reviewed journal, I think in the BMJ recently, that the British Medical Journal recently, that the efficacy is much higher after you delay the second shot to after 19 days. And that's why, based on evidence, Malaysia is also recommending the second dose to be injected only after 90 days.
Very
good. The earlier trial that looked at a shorter duration, the efficacy was much lower as compared to 90 days, the second shot.
And I hope that answered your question, PL. And there's one question from the audience was, is it true that we cannot take Panadol before taking the second dose vaccine, as it would nullify the effectiveness of the vaccine itself?
Okay, so when you deal with things like anti-inflammatory medicines such as aspirin or some non-steroidal anti-inflammatory drugs such as ibuprofen, Votrient, all these painkillers, generally it's recommended not to take them a few hours before your vaccine. But if you're on of course, like you have a heart patient and you're regularly on aspirin, that should not stop you from taking your aspirin on that day itself, because the risk of you getting a blood clot in one of your stents in your heart or something is high. So you shouldn't change that routine. But if you are just doing it based on pain, then perhaps you may want to delay that to after your vaccine. But there is currently we don't see any contradiction between. There's no guideline to say that you can't take a Panadol after the vaccine. In fact, we at the vaccine center, you would have noticed that we routinely give people Panadol after we will give you free Panadol after the vaccine, just in case you develop a fever at night, or you feel a bit sore, general body aches. These are the common side effects of the vaccine. So there is no rule to say that you can't take any of these after the vaccine. Although generally people would, I guess, if you're very concerned about certain more potent anti-inflammatory drugs, then this should be brought up to your doctor as well.
Very good. Now we all know that we'll get free Panadol if we go for after the vaccination.
Yeah, I'm not sure whether it's at all centers, but at least where I was taking my vaccine, I was provided with Panadol.
Oh, okay. But okay. Yours will be in UM, right?
Yes,
yes. So you talk about blood clot just now. If you're a heart patient that needs to take aspirin, to prevent blood clot in your stents. So referring to that, right? The last question for today is referring to thrombosis. This is also closely related to poor circulation or low BP. What are the concerns that a patient should be aware of if they have such issues, and the possibility of any side effects from the vaccine?
Well, so if you have a history of thrombosis or clots, then and if you are at that high risk group that has been reported as we see in the side effects of AstraZeneca, then obviously this will not be the best choice of vaccines for you. So unless you are in an age group where the vaccine's risk is very, very low, and you have a history of thrombosis, then I think again it goes back to the doctor treating you whether he recommends this vaccine over another for you. He may choose to say that maybe you shouldn't consider this AstraZeneca vaccine, you should consider another type of vaccine instead. So these are all based on each individual, and there's no one rule, blanket rule for all sorts of patients with thrombosis.
Thank you, Doctor. And these are all the questions we have for you today. Thank you so much for taking the time to just answer questions from the community itself. I hope you guys have found this really, really useful. Just to summarize, at the end of the day, it's really a calculated risk. The objective of this webinar is to educate and bring sound facts and knowledge to the audience. And I hope that you have you have taken away some of the wisdom from Dr. Poh today. Thank you so much, Dr. Poh. Do you have any last words for the audience?
Not really. I think we should always, I think you have said it very, very well. We should calculate the risk of us getting COVID infection, because if you do get COVID infection, the risk of, I think you've heard it so much in the media, the risk of getting blood clots. I see a lot of blood clots in my COVID patients. A lot of them come down with blood clots in their lungs, what we call pulmonary embolism. The COVID virus itself and the infection can cause blood clots. And if your risk of getting COVID the virus itself is very, very high, then getting the vaccine makes all the more sense. And with the global shortage of supply now, obviously, as you can see with the opt-in version with AstraZeneca, a lot of people have opted in, because the risk of complications from the virus is, of course, much, much more than any complications that we can find with the vaccine. Obviously, the percentage is low, but the effects are real if you are below. I mean, if the reported groups have been below the age of 50 in the UK, so you need to be aware of these risks. And if you are willing to take that risk, then by all means go for the vaccine.
Thank you, Doctor. And there are questions on, we will be sending you a PDF on some of the questions that have been answered to the attendees. And also, if you're in HR today and you're attending today's event and you would like to know more about COVID-19 vaccination, my colleague will be giving you a link as well to submit your interest, so that we can move forward from there and send our consultant to speak to you more. Thank you so much, Dr. Poh, for your time. Yeah, that's all for today. If you have any further questions, feel free to reach out to us. Yeah, have a good day, and guys, sign up for your vaccination on My Sejatra.
Thank you, thank you, Joey. Thank you all.
Thank you, Doctor. Thank you, everyone. Have a good day.
Take care.
Bye.
Bye-bye.